My name is Dr. Howard Austrager, and I'm a board-certified chiropractor with over 12 years of clinical experience treating hundreds of fibromyalgia sufferers. In addition, I have over 100 hours of graduate-level training in clinical neurology and nutrition. Now, today I would like to talk to you about fibromyalgia. Now, fibromyalgia basically means you have pain all over, you're chronically fatigued. Many patients tell me it feels like they have the flu, every day, all day. The problem is there's no lab test, no blood work, no imaging studies like an MRI or CAT scan that will diagnose this condition. Now, most fibromyalgia patients are diagnosed by, a rheumatologist, a doctor who specializes in arthritis. And there are supposed to be 11 of these 18 trigger points. Some people have 9, others 15. It really doesn't matter. But unfortunately, many doctors feel that these patients are faking it or it's all in their heads and something that they have to live with. Now, according to the study of Journal of Neuroscience, the longer that an individual has fibromyalgia, the greater the gray matter loss in your brain. So with each year of fibromyalgia being equivalent to 9.5 times the normal loss in aging. Let me repeat this. For every year you have fibromyalgia, it's like your brain and your body are aging 9.5 times faster. Wow. Now, I would like to talk to you today about the causes of fibromyalgia. In every case of fibromyalgia that I have treated, the main cause is an overfiring of something called the mesencephalon or upper brainstem. This is the part of your brain that controls autonomic functions in the body. These are things that happen, without you thinking about it. Breathing, your heartbeat, digestion, just to name a few. Now, your brainstem has 3 parts. There's a top, a middle, and a lower. They are called from top to bottom the mesencephalon, the pons, and then the medulla oblongata. Now, normally your cerebellum, the part of your brain that controls balance, coordination, as well as the structural muscles of your back, fires to this frontal lobe of your brain. And this part of your brain fires to your lower brainstem, which kind of helps slow down and regulate that upper brainstem. Now, when you have fibromyalgia, there's a disruption of this normal cycle. Now, your cerebellum is underfiring to your brain, so in turn your brain is underfiring to the lower brainstem, so you lose this firing. Now, why do you lose this firing? I'm going to tell you. Stress. Chemical, physical, or emotional stress. Now, when you're stressed, your body releases cortisol from the adrenal glands, and cortisol is toxic to your brain, especially in an area called the hippocampus, which lies, kind of deep there in your temporal lobe. That's why a lot of people who have chronic pain and fatigue or under severe stress have problems with their memory. I see people after they've been in an auto accident and they develop fibromyalgia. That's a physical stress. People who have smoked their whole lives, drank too much, took too many medications. This can contribute to chemical stress, but emotional stress is the big one. Many times when talking to a fibromyalgia patient, they begin to develop fibro after a big emotional stress, such as the loss of a job, the death of someone close, some physical abuse in their past, a divorce, financial stress. All of these severe stresses cause your brain to decrease its firing because of this toxic release of cortisol. Now, when this upper brainstem overfires, it drives down your spinal cord and causes these adrenal glands to release catecholamines and norepinephrine. Now, when these are released into your bloodstream, they stimulate things called these type C nociceptive pain fibers. These are small little pain fibers which are the most sensitive in the body. And when these pain fibers become excited, it can cause headaches one day, back pain the next, knee pain or arm pain the day after that. I used to have a fibromyalgia patient. She was so sensitive that literally the shirt on her back made her uncomfortable. Now, standard medical treatment is medication. You try different medication, try this one or that one for the pain or depression, but they're not really concentrating on what's causing the problem. Now, if these medications don't work, then what are you going to do? One of the biggest symptoms with fibromyalgia is chronic fatigue and problems sleeping. Now, the reason that people are not sleeping is because of this overfiring mesencephalon. This causes disruption in something called the mesencephalic reticular activating system. It controls your sleep and awake patterns, so it's firing its highest at 3 a.m. and lowest at 3 p.m. This is why you can't sleep at night and you're exhausted in the middle of the day. Now, this high output or overfiring mesencephalon causes symptoms that many fibromyalgia patients experience, such as sensitivity to light is a very common symptom. This is because the 3rd and the 4th cranial nerves are based in this mesencephalon, and the 3rd cranial nerve controls the constriction and dilation of the pupil. Now, when it's not firing properly, this pupil will stay dilated and won't constrict when it's exposed to light, which makes you oversensitive to light. Now, another symptom is, is a racing heartbeat. Now, when this mesencephalon is overfiring, it excites a part of the spinal cord called the intermedial lateral cell nucleus, or IML for short. This IML sends signals down to your SA and AV nodes. These are electrical areas of your heart. The SA node is located on the right side and the AV node on the left. They kind of act like circuit breakers that control the electrical impulses which control your heart rate. Now, when the pontomedullary region, which is the lower part of your brainstem, fails to slow down this mesencephalon, the IML fails to function. This causes abnormal firing of these two nodes, which in turn cause heart palpitations or changes in your heart rate. Some other symptoms that are very common with people with fibromyalgia are constipation and diarrhea. Now, when this mesencephalon is overfiring, it can alter a portion of your brain called the nucleus tractus solitarius, tongue twister there. When there is a disruption of this part of the brainstem, it can affect the function of something called the vagus nerve, which is cranial nerve number 10. This is the longest nerve in your body. It goes from your brainstem all the way down to your colon. So when there's a disruption of this nerve because, this overfiring mesencephalon, it can affect the peristalsis, or the movement of food, through your intestines. This can lead to bowel problems. Now, these are a few of the most common symptoms that affect people with fibromyalgia. Other very common symptoms include migraine headaches, blurred vision, dizziness, vertigo, high blood pressure, and the fibrofog, or flu-like symptoms. Now, so the question is, can this brain imbalance be fixed? And the answer is yes. There has been a realization that a brain older than 3 years can be changed. Used to be that, okay, once I get to 3, my brain's the way it is and I can't do anything about it. But something has been discovered called neuroplasticity. And this means that you can create your brain from the input that you get. That meaning really you can create these new neural pathways or fix damaged pathways using outside stimulation. So by using these different therapies to stimulate different parts of your brain and create these new neural pathways, we can improve the overall function of your brain. Alright, that's it in a nutshell. Now, so what makes my office different? In our office, we treat patients neurologically, structurally, and metabolically. Most healthcare practitioners look at someone from a pain perspective. We look at the body as a whole. We use a multi-step procedure in evaluating a person's health. First, we want to know what your problems are, all of them, and which ones are the most pressing. Second, we do an initial screening to determine the degree of evaluation that is needed to diagnose your problem. And then this evaluation is performed based on the complaints and your initial screening findings. The last thing we do is we give you a report of findings, and we kind of explain what is wrong and why you're likely having the complaints that you have, and what type of treatment choices that you have here in our office.